Hello, everybody. This is Dr. Zhang from Roselle Center for Healing. I hope everybody is doing well right now. Please be safe. Today, I will talk about addiction, chemical and emotional. So, addiction is very crucial and very common right now. So, why? Because addiction does not only include the chemical and emotional addiction, but also there are the many kinds of different addiction too. So I will talk about it later on a little bit. So today I mainly talk about chemical and emotional, but still we'll talk about a little bit of the other emotion too. So let you aware, probably you are in addiction mode, but you don't know. Okay. So this presentation, I have 5 parts. The part 1 will tell you about the definition of addiction. What is addiction? What the addiction can affect your brain. So that means what's the physiology, what's happening in your brain when you have the addiction. The second one, talk about the chemical addiction, tell you about the risk factors, tell you about how the chemical change your brain. The third one is emotional addiction. Emotional addiction is pretty new concept actually. It's not very probably some people do not know, don't have any clue what is emotional addiction. So that I will talk about that too. So number 4 is it's definitely is approach the way how can we treat addiction. Okay, so we definitely tell you what's the right way or proper way to approach addiction, to change, to reverse the symptoms you have after or even before addiction. Okay, the last one, but not the least one, I talk about the tape. So when I say the tape, that means in every lecture, I will tell you guys a little bit tape, so you can bring home to do some exercise. Okay, so because I know a little bit more about this because I was a Chinese doctor in China, Chinese medicine doctor in China. So Chinese medicine was designed for preventing disease, preventing problems, and it's not for treat problems. So in the old Chinese books, many years, 1,000 years ago, probably the first Chinese medical book said the best doctor is not for treating people and how well treat people. The best doctor is they tell you how to prevent get sick. Okay, all right. So let's start. So the definition of addiction. So what is addiction? So there's our institute. There's a National Institute on Drug Abuse. Give you the definition. But this definition, remember talk about the definition not only include the chemical or drugs, but this definition is very detailed. Tell you guys what is the drug addiction. So I'll tell you, drug addiction and emotion, no matter which kind of addiction, is all addiction. The same, yes or no, different, yes or no. At some point they're same, but some point they're different. Okay, so the addiction from the NIDA, they said addiction is defined as a chronic. It's not acute. So that means somebody said, okay, I just like take a one-time drug, I'll be fine. No, that's wrong. So if you take it one time to the second time, and as time goes by, it becomes chronic. Okay, so chronic relapsing brain disease, you say it's a brain disease. Okay, so and also if you have brain disease caused by the chemicals, it definitely causes a lot of harmful consequences. Okay, so because the same drug change the brain, they change the structure of the brain and also change the chemical of the brain too, which is have long lasting and leads to harmful behaviors in the people who abuse drugs. That's what you can say. Some people, most of the people have addiction. They have very bad behavior because their brain get changed. The brain chemicals get changed too. Okay, so we'll talk about it. Say it's not only drugs, but also emotion addiction. You see alcohol addiction, smoking addiction, and electronic device addiction. Electronic, it's very easy to understand alcohol and smoking addiction, but electronic device kind of like this, the easy to understand, but not probably a lot of people didn't notice that, is not aware of electronic device addiction. For example, I talking on TV. That's one day. His mom came to me and said he's very sad, upset, he's a little bit stressed. When I asked the reason why, she said, okay, because my kids cannot get rid of electronic device, always on the phone, always on the video games, always on the iPad, I said, okay, so same thing is very popular, so how about you? So you're on the phone, how often you on the phone, right? Just ask your question. How often you on the phone? Can you stay there or do something without a phone for 1 hour? Probably most of people will say no, right? So same thing, this is addiction too. As the time goes by, it will change your brain function, brain chemical too. Okay? Shopping addiction. So when I say this, probably a lot of people will laugh. Shopping addiction. So for example, some people will say, okay, I'm very stressed. After shopping, I feel better. Right? After shopping, I feel happier. So that means that's why they keep shopping. They make them happy. Okay, it's addiction too. Right? Okay. So we talk about that. So addiction is not a short term; it's a long term. It's a long term disease. Okay, it's the individual, the people have their addiction has an overwhelming desire to find or to use some drugs, even though they are dangerous consequence, or even though the dangerous consequence. So this is also the disease. They can change your brain structure, function, and behaviors. Okay, we have the 5 apples there can shows you what the indications can shows the progress. Okay, the perfect apple, you have a little addiction, and then as time goes by, your brain will get rotten, right? Your brain get affected, your brain chemicals change. Okay. Same thing. This picture can shows you your brain on drugs, just like the egg, the fried egg on the pan. All right. So there's a couple of risk factors can cause addiction. Same thing. We always want to try to find the cause. What's the reason cause that? What's the reason to push you go to addiction? Right. The first one is addiction problem. It's genetic. So we're not for sure how many percent, but it for sure is genetic. Okay? It happens at early age of the onset, That's why a lot of teenagers, to have a lot of addiction to drugs, and also have young people have alcohol addiction, smoke addiction, absolutely. So, and also because the adults use a different brain to have addiction problems, other than the teenagers or younger people, they have their brain still developing. They use different part of brain release different chemicals and cause addiction. Okay, so we'll talk a little bit more about later on. So the third one is the childhood trauma, the violent or sexual, this kind of trauma emotionally can cause addiction too. Learning disorders, ADD, ADHD. So if you listen to my radio, you will know. So we talk about not only ADD, ADHD cause addiction problems, addiction problem can reverse cause ADD, ADHD problem too. So they affect each other. Okay. So same thing with mental illness too. Mental illness, depression, bipolar, psychosis, ADHD, anxiety. They because they suffer from the mental illness, and they try to seek a different way to make them happier, to make the depression go away. So vice versa, if you have addiction problem, because they change your brain chemicals, it can cause a problem too. It causes all the mental illness too. So environmental factors can contribute to the addiction, right? We talk about the stress, peers, and also same peers around you, the around you who use the drugs can affect you. Okay. And also same thing, it's easier to get a drugs, and it's easier to get the addiction. Okay. So now we talk about like chemical addiction. Chemical addiction. So before we talk about chemical addiction, we want to talk a little bit about the brain, how the brain, the reward pathway go. So the nicotine into the brain is a different chemical, not only nicotine, but also the other chemicals too, drugs. They can stimulate their brain receptors and release the pleasure chemicals. The pleasure chemicals include dopamine, serotonin, endorphin, melatonin, all these kind of chemicals, the pleasure chemicals. Okay, if this stimulated release the pleasure chemicals, and then your body want more of this kind of bad chemicals from the outside to get up happier. Same thing, everybody want to get happier. There's nothing wrong. But same thing, if you take too much chemicals, it will change your brain, just like the apple we talked about before. Okay, so why we talk about why the people take drugs in the first place, right? So they want to feeling better, they want to have better sensations, they want a better experience, they want to share with other friends, the other the colleague around you. Okay, they want to to make the anxiety go away. They want to less worries, less fear, less depression, less hopeless. When you say less fears, less depressions here, so they kind of like the little emotion addiction too. So we'll have separated the session talk about emotion addiction. Okay, so same thing. Drugs, addiction engage the motivation, the pleasure pathways of the brain we talked about before. This is the picture published on the Time magazine. It is a great picture, even though it hurts you, possibly hurts you, you still want to take that. This is addiction. Something attracts you to go there. Okay? All right. So dopamine, what's the dopamine means? Dopamine is a neurotransmitter. It's the brain to make you have more movement, more active. You have to take more movement, active, and they can give you a lot of motivation, do something. If somebody said, okay, I don't have any motivation, just do something, probably you have a late dopamine problem. And also dopamine that's the reason cause addiction too, because they can make you happier, make you reward, make you enjoy the well-being. Some people, especially a lot of emotion, anxiety, depression people said, okay, I do not have any motivation. I feel hopeless. I don't feel hope when I use this word. It means possibly your dopamine is not releasing from the brain enough to satisfy you. Okay, dopamine is not only dopamine, but also the other neurotransmitter too also get affected. So there's all happy we call it happy hormones. Happy hormones. It's dopamine is more, endorphin, oxytocin, serotonin is all happy hormones. Okay, they did a lot of research shows that has shown the other neurotransmitters neurotransmitter systems are also affected, serotonin and glutamate, and also, endorphins. The serotonin can regulate your mood, sleep, and glutamate definitely regulate learning and memory. Okay. All right, mental illness and substance abuse. We talk about why generally they happen at the same time, having the co-occur. Okay, so the first reason is the self medication. So substance abuse begins as a means to release the symptoms of mental illness. Right, we talked about before. So what happened there? Because some people want something to release something. Okay, and also the substance abuse is also increase the vulnerability to mental illness. Okay, the risk factors and also can give rise to mental illness, and substance abuse may be related too. So all these mental health problems, mental illness problems, and also is very strong related to substance abuse. That means you have to be careful. If some people have have anxiety or mental problems, you have to be careful. You very have a possibility to get addiction or substance abuse or the drug addiction, or even though the other addiction too. Let's move forward to talk about emotion addiction. Emotion addiction is a very, very interesting topic. Probably a lot of people don't know what is emotion addiction, right? What is that? How that happened? So emotion addiction is far more powerful than human. Is more powerful than human emotions. Okay, so it can cause the chemical addiction. So emotions are extremely powerful. So when you properly manage the emotion, so your emotions can expand your ability for productivity and self-care and healthy relationships. Okay, so those who have emotion addiction is become hooked to feeling a familiar way to or responding to their powerful and innate emotions. So the brain will give off chemical reactions in response to certain emotions. It's very similar to those experienced while taking part in the other addictive behaviors or substances. Okay, so people with emotion addiction can become dependent on certain emotional comfort or relief or distraction or escape. This is emotion addiction. So with emotion addiction, it actually is 1 in 7 people in United States were suffering from some type of drug addiction, okay, in their lives. But there are many circumstances that lead to addiction, but same thing is not, we talked about before, now are more powerful than human emotions. So when we talk about emotion addiction, the fear is the first one I want to talk about. So fear is an emotion addiction, so that can lead to a downward spiral. Someone who is prone to this negative emotion might be unable to think rationally, to think properly. So instead, they might turn to go to their substances abuse in order to put off the inevitable, right? For example, so some people might be struggling with a fear about growing up or just the future in general. Okay, they try to escape their fear and then on their own, to do something to avoid to go there if possible, right? So same thing, fear is not something that give away to protect life. Actually, it's that emotional pain, addiction that can lead a person to become use of drugs as a means of escaping negative thoughts patterns. Okay. Unfortunately, they will not. They won't do anything to help, and often leads to chemical addictions. It can be much harder to shake. Okay, so anger. Anger is the second one I want to talk about. Anger is another major emotional addiction that can often lead to chemical abuse. So someone is overcome with the constant anger, will look for anything to make them feel more, at least with their life, right? If you're constant anger, you find a way to ease you, to comfortable, to happier. Okay. So anger is an emotion addiction that can cause major issues in a person's life. So their personal and professional relationship can often suffer. So it can also have devastating effects on their mental health. Okay. All right. Third one is grief. So grief is an emotion pain addiction that often gives away reckless behavior. If someone is faced with an extreme loss, they might find it difficult to care about anything else. This leaves them especially vulnerable to turn to drugs as a means of feeling better. Okay, so when it's a group, if you listen to my lecture before, so I talk about every organ has every organ's emotion, right? So anger is labor. Okay, grief is a lung, fear is your kidney, adrenal. Okay, if you have fear, you have a fear addiction, probably you potentially have lung breathing problem, and the lung and the large intestine gonna attach each other. If you have a lung problem, probably you have a gut or large intestine problems. Okay, all they connect each other. Depression. So depression is a very common emotion addiction that many people struggle with. So the most common mental disease, actually it is the most common one, mental illness in the United States. Okay, so depression is very similar to grief because it leads a person to behave recklessly. Someone who does not care about anything is especially vulnerable to developing a substance addiction in order to cope with their feelings. So it's very unfortunately, most people who struggle with depression do not seek a professional help to deal with their problem. So instead, they try to they become an emotional pain addiction that can suck the joy out of their everyday life. And also another scenario, people will seek help from drugs, from chemicals, and for addiction. So you can tell how emotional addiction can hurt you, can damage you. Okay, desire. So desire, not all emotion addictions come from feeling associated with sadness, but in fact, there are also some positive emotions can lead a person vulnerable to drug addiction. Okay, so while there is this desire, basically, so someone has always have the desire to do something maybe can very quick turn to drugs in order to achieve a very high, that can make them feel even more alive. Okay. Also, even though their curiosity can be innocent at first, it can quickly lead to problems down the line. Okay, desire is an emotional addiction that can lead someone to always want something new in their life, while some people channel it in possible positive ways. So such as the travel, they might, look for drugs in order to experiment. Okay. All right. So the last one, the pleasure. So pleasure is another emotion addiction. It can lead a person to pursue it. So this can lead to a variety of addictions such as sex or gambling. We talk about gambling, Dr. Roselle talk about gambling, but also leads to drug addiction as well. So you can tell all this kind of emotions, is very common in the general life, can cause a lot of problems. That's why I probably have a little general idea what is the emotional addiction. Okay. So we talk about emotion addiction, we talk about, the chemical addictions and also the other electronic device addictions, software addictions. But they all can affect your symptoms, they all affect your brain function. They all affect your chemicals in your brain to alter your function of the brain to let you become addiction to something and then behave differently. Okay. So that's the way. Yes, definitely the answer is yes. We definitely the way to approach addiction. So same thing. Your inability to stop, is the addiction. Just like you're riding the car without a brake. You don't have the brake in the car. It's very dangerous. So you have to be stopped as early as a slow speed instead of just like high speed. Okay. So again, we can say addiction is like the other disease. The first one is preventable. We talk about the best doctor is supposed to be the doctor who will teach you how you prevent the problem instead how you treat a problem. Okay, it's preventable. And also, it is treatable too. It is treatable. So don't give it up. Don't be hopeless. It is treatable. And also, it can change biological. That's biology. It can change biology. So that means, we can use different way to acupuncture is the one I'm talking about later. Acupuncture is the one can stimulate you change your brain dysfunction. You can bring chemicals to release some happy hormones instead of chemicals. They can be changed. So, but if untreated, if the addiction is untreated, it can last a lifetime. It can cause a lifetime long problem. Okay, we can say the decrease the brain, the drug abuser, it can be brain different. So the left side is a healthy brain, and the right side is decreased the brain, and is the diseased brain. It can cause the brain structure change. This is from the drug abuser, from MRI. Also, same thing. If you have a heart problem patient, the underlying problems, if you can see here, the left side is a healthy heart, and if the right one is diseased heart. This pathological change already is very dangerous. Okay, these pictures are all from NIDA. Okay, it's very dangerous. So just remember, the addiction is treatable, is preventable. It can change a lot of chemicals in your body. If you get it untreated, you can have time. Okay, so acupuncture. Acupuncture, actually, acupuncture was introduced to U.S., to European countries. So as the first use is to treat the addiction problem, drug addiction problem actually. So it's about 1985, 84 area. So May period is about mid 1980s. So they were introduced from China to American to do the addiction problem. It works very well. So why? Because acupuncture. Why? What is the acupuncture? So then, probably some people do know, some people don't know. Actually, acupuncture based upon Chinese medicine. So Chinese medicine based upon Chinese philosophy based upon the 5 elements, the yin and yang pattern, all the philosophy. So they think, Chinese medicine think, why people are alive? Because all the organ has all the organs energy. All the energy move in specific pathway, we call it meridian. So there's a lot of dots, we call it points, a lot of dots and points on the meridian along the pathway, the channel, the meridian. If your energy is blocked in the different specific the channel, and then you get sick, definitely for sure you get sick, then you could use a specific needle to stimulate the channel, put a specific points, and then make the energy flow better. Then you feel better. You feel healthier. That's the main principle acupuncture to do. Same thing with the addiction problems. So why? Because the energy in the brain or energy specific points or a liver or the lung or the gallbladder is not moving very well. They cause the brain dysfunction, and then cause the energy stuck in there. We have to use some needles to stimulate that. This is the principle of acupuncture. Okay. But, we just say it's based on experience. We do not know what exactly they do. But however, we do know now. Before, we didn't know. But we did a lot of research, from Western countries, Americans or European countries. There's a lot of research about how acupuncture can affect your brain. Okay, they did a lot of research. They did conclusion. Okay, so acupuncture can elevate the level of endorphins in the body, which provides the relief from cravings and calms the nerve. Cravings. Cravings is kind of like another word for addiction too. Okay, several brain neurotransmitter systems involving the opioids and GABA has been implicated in the modulation of dopamine released by acupuncture. You see, so acupuncture can promote, make your brain release normal hormone to make you, get rid of the addiction. Some people may ask me, okay, can I be addicted to acupuncture? I mean, that's a good question. It's a very good question. So the answer is yes or no. So why? Because no matter it's acupuncture, no matter it's chiropractic, no matter it's all the natural therapy, the main principle, the foundation is they want to stimulate your body to let your body work better to don't use the other heavy or strong medication to heal you. Because they think the body has the ability to help themselves. But sometimes because this different reason, they just lose the ability to heal themselves. It's the only reason why we need some of the other thing to help you to gain the ability back to help to heal yourself. So that's why I say no, you will not get addictive because of all the natural therapy to let your body gain your ability you have before. Okay, we call it innate intelligence. Okay. All right, so same thing, acupuncture. So acupuncture, a lot of people know acupuncture is probably just like from insert the needle to somewhere in the body, but actually, auricular acupuncture is the most common acupuncture for treat their substance addiction. So in both US and UK. So not only than that, because I have some patient has 35 years or 40 years addiction for smoking, for alcohol. So I treat them probably 2 or 3 times a week for about 3 or 4 months. But sometimes it's not enough. So I will do some auricular stimulation. What's that mean? So auricular stimulation means I use some seeds, very small seeds. These very special seeds, or some beads, or some magnet, the beads. Put it in the tape and put in the on the air, and then let's give your ear, give the body constant stimulation. Even though I don't do acupuncture, I won't do acupuncture for 25 minutes. So even though after 25 minutes, I put a beads there, you get a constant stimulation. And then same thing, when you feel you want to get something to satisfy your addiction to something, you could stimulate the beads or the seeds in the air, and you can go home and do that. So then to give you same thing, to give you constant stimulation, you can get a better result. Then you can constantly tell your brain, to release growth hormones. And also, other than that, I also put sometimes if this more severe, I will put more severe problem. I will put a little bit tags. The tags is very, very small needles. They're very, very tiny. You barely see it actually. So especially except you're very, very close to that. So I put in the air to go home. It's a very special treatment. I don't know. I don't think a lot of people do that, but I do that too. So I get a very good result from that. Okay, gut. We talk about gut. You have to fix that gut. So gut is second in brain. We talk about the neurotransmitters, right? We talk about a neurotransmitter. We talk about how the brain affect the brain, how the addiction affect your brain function. So gut. So there's one day last Saturday, the guy tell me, we talk about the gut with the brain. He said, Dr. Zhang, so I heard if you die from the gut. Okay. So I said, you're absolutely right. Same thing. If somebody has a gut problem, if somebody they lose appetite, it's not right. If you lose appetite, that means you definitely has a problem. So that's why I always ask people, do you lose appetite? How's appetite going? Right? If you said, my appetite is fine, okay, perfect. So you're good. So why? Because 85% neurotransmitter made in the gut goes to your brain. Okay, 85%. So same say, if you don't have enough gut to support gut function to support your brain will be lack of the neurotransmitter, right? So they can cause problems. That's why when we treat the addiction problem, we have cooperate with the nutrition department to fix the gut, to give you enzyme, to give you a good diet. Make sure you have enough, nutrients to your body, and then to produce more the neurotransmitter, right? Okay, so the brain function management. So when we say brain function management, we talk about the adjustment. So, but some people misunderstand chiropractic. They think, okay, chiropractic is only really the pain, it's a pain relief. It's all about sore relief, but the answer is absolutely not. So brain actually chiropractic the goal of chiropractic adjustment is to alter the brain dysfunction, alter your brain function. So remember, all the nerve come from the spine, the nerve come from the spinal cord, and spinal cord connect to your brain. Right? If you do have some spine problem or misalignment, or as you get a trauma, you affect the nerve flow, you affect the spinal cord function, and then it will change your brain function too. Right? So from that way you can tell adjustment can restore the function of the brain, or restore the function of the nerve, can restore the function of the spinal cord, and restore the brain function, make the brain function better. That's why I don't remember how many patients told me, I said, okay, you know what? After you adjust me, I feel my memory is better. I feel happier. I feel more fresh. I feel more pleasant. I feel more enjoy well-being. That's the best answer I want to hear. That means your brain function getting better, right? Okay, so the gut function, brain function is all connected together. Dr. Zhang asked me the question, said, okay, do you use the same way to just patient or to treat a patient, to treat a different addiction patient? The answer is yes or no. Because we use acupuncture, we use the gut, we use the change the gut. We improve the gut function. We use their brain management adjustment. This is the same. This is the answer. Yes. No, because different people are different, condition. Different people, the person, their body type. So even though we use the three things, but however, for different people, we choose different points for acupuncture. We choose different enzyme for the gut support. We choose different food for the different people, and also we choose different segmental adjustment for different people too, right? Segmental adjustment. All right, so this is now. So the last but not the least, always we talk about, we have to teach the patient how to do something at home, right? To make you feel better. So the best one is I call a happy spot massage. Actually, I didn't see this one. The people tell me this. I do this spots, for the patient. The patient, you know what? Every time you do these points, I feel so much happier. I think it's a happy spot. I said, okay, cool. It's very, I feel called a happy spot massage. So that's the points here. It's between your eyebrow. Okay, it's just between the eyebrow. In Chinese medicine, we call it yin tang points. Yin tang, right? So massage the yin tang 5 minutes a day. Massage every single day. Okay, you will definitely feel change. You will definitely feel you can calm down your mind. It's very good for a lot of emotion people. It can improve your sleep. If you don't sleep very well, you massage here 5 minutes. You just simply put the fingers there. You can do that when you're tired, do something, or you have break. Just very simple. Just massage no matter. I would do clockwise 2.5 minutes, half time, and a counterclockwise half time too. Just in balance. We want to balance. Everything want balance. Yin and yang balance, inside and outside balance, and up and down balance. Okay, same thing. They can also reduce congestion, your nasal congestion. Okay. All right. So then same thing always. This one always on my lectures. I believe keep healthy, do no harm. So you have to make sure your body is much stronger. You can get rid of a lot of things. You can do a lot of things, without getting sick. Okay. So thank you for listening. Okay, don't go away first. Don't go. I still have something to tell you. Okay, so all my lectures is down right now, but I mean the academic lecture. But if you have more questions, this I promise is last page. If you have more questions about I talk, can call my office. You can call the office. You can leave a message there. You say I have some question for Dr. Zhang. I will call you back after work. So simply saying, if you have question, if you want to sit down with me to do a little bit of consultation, a little bit of even the evaluation, I'll be very happy to do that. So simply saying, our boss, Dr. Roselle, has been doing the charity for a long time, to caring for others, to charity. So you can sit down with me. Evaluation is supposed to $225, but however we do the promotions every time with lecture $299. So this $99 not goes to everybody except goes to the care for others. It's tax deductible. Is care for others. donation. It's donation. Okay. So yes, if you have more questions, if you want, to sit down with me if you want to manage your health, even not only addiction problems, if you want to manage your health better, let me know. So I'll be very happy to help you. I'm more confident to make you better because I know a lot of tips to let the body to function better, to prevent a lot of things. All right. So thank you for listening. Thank you for watching. Thank you very much for everything. So please be safe and drink more water, take more vitamin C, take D, take zinc, take probiotics. All this essential, all this kind of immunity support. Okay. All right. I hope to see you soon. Bye.